You don't want to do your normal functions. And you're very lethargic. So again, and then dementia. It's a gradual, progressive deterioration. And one form of dementia that we learned about is Alzheimer's and also sundowns. Sundowns is basically when a patient kind of just goes off, or goes off would probably be the best way to explain it. And it's usually when the sun goes down. I was talking to my clinical teacher yesterday, and he kind of wants to throw that one out because from what they're saying, they can't really pinpoint sundowns. And what really causes it. Is it because the patient's family is going home? Or is it really because the sun is going down and it's getting dark and maybe they get into a lonely place? So again, those are the 3 Ds: delirium, depression, dementia. They'll probably come back, I'm sure. We'll probably learn some more about those. My favorite, and I'm just going to touch a little bit on this because personally I feel like I have beaten this horse down. Down. And it is therapeutic communications. There was a lot of, not really a lot, but there was a good bit of therapeutic communication on test 1. Therapeutic communication at the end of the day is how to talk to a patient. You want to give open-ended questions, things that do not require a yes or no answer. Things that really things that you can build conversation off of at the end of the day is basically what therapeutic communication is. So a few that you may use on an everyday basis is offering a general lead. And that is where the patient takes direction of the conversation. You can say things like, go on, tell me about, continue, where do you want to begin? This gives the patient the opportunity to decipher where this conversation is going. What things are you going to talk about? It's all about the patient, which nursing is. It is very patient-centered. Remember that word because it will come back to haunt you in every test. I'm sure it was on test 1. It's very holistic, patient-centered. It's all about nursing. Another one is giving broad opening. And these are things that encourage the patient to take the lead on a conversation. And these are questions like, where do you want to begin? Is there something that you would like to talk about? These are things, again, that will get the patient talking and decipher where they want the conversation to go. Things that you don't want to do in therapeutic communication is you don't want to judge. Never judge. You never want to ask why. If you see a question on a test that has anything to do with therapeutic communication, and it starts out, one of the answers starts out with why, that is the wrong answer. Do not pick it. Why is never a good question to ask a patient because the patient becomes very defensive. I'm sorry to go off on a tangent, but why is not a good answer. Exit out of your mind. Do not think why. Do not say why. Now, back to business. I'm trying to think of another non-therapeutic communication. Disapproval and giving approval. You never want to give a patient approval or disapproval. You want to, in a sense, make them feel like the ball is really in their court. You are there to support, empower, teach, never to judge, never to pass judgment, never to agree or disagree. You never want to tell a patient that there is a sense, I take that back, there is a time where you want to tell a patient they did a good job, but you don't want to approve of negative behaviors, in a sense, is kind of the way that I remember it, because there is a time where you do want to give approval. There is, and it's not really approval, but it is validation is the actual word for it. So I'll tell you the difference between the two. So validation would be like, Miss Johnson, I see that you wore a new dress today. You look very nice. You are letting that patient know that you see what they did and it's in a positive light. Now, things that you don't want to do is disapproval. So you don't want to tell a patient, it would have been better if you did X, Y, and Z. It would have been better if you wore the red dress instead of the yellow one. I don't think that's a good color for you. No. X that out. It's not. When you think of these things, you really want to think of, I think of being proper. So it kind of really falls back on how you are as a person. You either know the proper way to talk, or you don't. You think that saying what do you want to someone that you don't know is normal. There's a time and place for everything. So just remember that when it comes to answering questions, just remember that in nursing, you are a professional. You have to think professionally. So instead of saying, when a person says, I'm sorry, I didn't hear that, or I'm sorry, I didn't hear you, and you say, what? You nicely repeat what you said. I hate the word what, and that's just me personally. It has nothing to do with nursing. I just hate the word what. Do not say what. It's rude. Off on another tangent. Alright, so some more positive therapeutic communication will be another one that I like, and not that I like, but making observations. So it's just letting the patient know that they're not really saying per se what they mean or how they feel, but you observe what this patient is saying from body language, from facial expressions. You will learn a lot from people's expression. A lot of people think that's common sense, but again, you will learn how people feel from their posture, from their facial, from, again, body language. So you do want to note incongruencies. So one question that I've seen a lot is a patient says that when he gets angry, he likes to drink and beat up on a dog. But the nurse observes that this patient is smiling when he says this. He didn't say that it makes him happy, but he did mention that when he gets drunk, he does these things. So again, it's just all about posture and body language and facial expressions. That is what observing means, to observe something that's not particularly said out front. Reflecting, I think of is a mirror. So basically you are repeating what a patient says to you. Example, my wife is cheating on me. Do you think I should leave her? What do you think you should do? Personally, I'm not a fan of reflecting because I would never say that to someone. But in nursing, you got to change your whole thinking. So again, reflecting is just reflecting what the patient is saying back to you in a question. Back in a question form, basically. So again, another example is, I want to move out of my house. Do you think I should? And then I would say, do you think you should move out of your house? Tricky. No. The next one is clarifying. And basically, you're just making sure that you understand. So basically, those would be examples like, are you saying that ... and just kind of reconfirming what the patient said. Pretty simple. A lot of these are very self-explanatory, but it's just the action of actually saying them and doing them. Understanding what's a good example of these. Again, don't ask why. Throw it out the door. Kick it out the door. Cut it out. Throw it away. Whatever. Another part of our test was about geriatric care, which again is fairly just things that are common sense. You know, as people get older, they lose sense in certain areas. Their temperatures become different, become colder all the time. Their sight's not as good, their hearing's not as good. Sometimes their language, their